Hi, I'm Patricia Greenberg, and this is It's Okay to Be Old. Well, I try to instill in my listeners the concept that it's never too late to improve your life, especially when it comes to our health. The changes we face as we age are multifaceted, and often we're told by medical professionals that there's nothing that can be done, just accept it. Aging is embarrassing to many people, and as a result, they don't seek help. Now, more and more, we're seeing alternative ways to deal with health issues that we once thought were untreatable. Today, I'm delighted to have with us Dr. Carol Stillman. She's a doctor of physical therapy, owner and founder of Sutton Place Physical and Aquatic Therapy, which she started in 1998. Her personal mission is to ensure patients of all ages receive personalized care so they improve their health and overall well being to live full, energetic lives every day. Welcome, Dr. Carol Stillman.
Thank you, Patricia. That was a very nice introduction. I'm happy to be here.
Thank you. So, Dr. Stillman, we all seem to know the basic lifestyle choices for longevity: healthy food, movement, keeping our weight in check, and of course, the big one, stress management. Why do you think that these basics are hard for people to follow?
That is such a great question. For myself, when I was younger, I really struggled with trying to make these kind of changes, trying to lose weight, trying to figure out how to exercise. I would always have great plans, but then they quickly fell aside and I wasn't happy. But one of the things that aging has taught me, I've matured in how I handle challenges. And I realize that in order to make changes, they have to be small steps. And for example, what I learned in weight loss, I found an app that really taught me how to change habits, what my unhealthy eating habits were, and really taught me about thought distortions that I wasn't aware at all that I had. So and that's one thing that I have learned with our clients is many people have the same kind of obstacles in that way. And we teach them strategies to break things down into small steps.
I wanted to add with that is that something that we all struggle with. And, as women, we say we have it harder when it comes to appearance and weight and so forth. I interview a lot of men and they feel the same way. I'm sure you find that also in your practice, treating both men and women, that this is a universal dilemma for people, is people don't know what to do. They don't know how much of it to do it. They always say, well, what should, at the age I'm at now, I'm in my 60s, who cares anymore? I'm in my 70s, who cares? We care, and we hope, that we can help people optimize their lives on every level. And we want to do it without the feeling of deprivation or the feeling of that you're behind the eight ball all the time. I know that's an old expression, but that you can't get ahead of it. And I know that's so not true. So here, I always say this in all my shows. I partner with my guests, like together we can work, to help people with this. So this is why I sought you out, after meeting you at a recent event that we were both at. Um, Really to talk about the two areas of interest to older adults. Pelvic health, sexual health plays into that, and it really wreaks havoc on our self-esteem, right? I mean, that's the other thing. And secondly is just this balance and falling and fear of falling. And we'll get to that in detail, but I myself am finding that I had a hip replacement a year and a half ago, and they kept saying, whatever you do, don't fall. Whatever you do, don't fall. Don't allow yourself to fall. And now I'm walking around terrified I'm going to fall. So, um, you know, first up, you're a certified pelvic health physical therapist. Tell us why this is such a hot topic and what's going on with that.
Well, I love to talk about pelvic health. It's one of my passions. In fact, I went back to school 3 years ago because I realized that to really be terrific as a pelvic health therapist, I wanted to get a certification, and I took a year-long program because there's so much to learn. And then, of course, that's only the beginning. But in actuality, pelvic floor PT was has existed since 1940 when Dr. Arnold Kegel um, brought to the forefront the Kegel exercises. And but it wasn't common for people to know about it.
Right.
But in the 60s and 70s, when women's health care was really brought to the forefront, there was a big movement that, hey, women have unique health needs. There's no standards. None of the research is being done on women. So that's when pelvic health became more common. But the reason it's hot now is because celebrities are doing it
Yeah.
and they are putting it on Instagram and Facebook. And you see I'm in several moms' Facebook groups, and all of them are like, hey, I had a cesarean, I'm really having trouble. What should I do? And then someone will say, you got to go to this pelvic health therapist. And then, everyone starts
Yeah.
chiming in. And so because of the internet, people can just type in their symptoms. So if you type in, urinary leaking, you're going to see a lot of suggestions and ads, but you're also going to get education, and that's where people are finding out more about
Mhm.
pelvic health.
So, I want to break it down a little bit further with, okay, so we have urinary leakage, we have painful sex, a feeling of, I had a C-section, so I know what that was like. And people think you're off the hook if you had a C-section, right? You didn't have a vaginal birth, so your vagina is still intact. But there's so much to that. What maybe I'm jumping ahead and you'll get to it. Are these symptoms reversible?
Well, that's a broad question because everyone's unique.
Mhm.
So we would have to understand, and oftentimes in conjunction with a doctor. So let's start with urinary symptoms
Mhm.
and rule out that there aren't medical issues.
Okay.
Uh, but so most people will come to me after, for example, if they have urinary urgency and frequency, they've been to a urologist, but the urologist also will say your pelvic floor muscles are very weak. And so we do an assessment. And the exciting thing that I learned when I studied to become a pelvic health therapist was everybody thinks if you're leaking that you need to do Kegels and pelvic floor strengthening. Well, actually, that can make you worse if that's not what your problem is, because a lot of people have tightness, which is what's causing the muscles to not be able to contract. And so when we do a musculoskeletal assessment, part of it, if the patient's comfortable, we do an internal exam. And often, so we have to figure out, does this person have tight muscles, which lots of like type A people do? And or is it because they have no muscle tone? They can't make a contraction at all. They think they are,
Yeah.
but and we can tell with both, we use one finger, gloved finger. We also have biofeedback equipment, but these things can definitely be reversed. One of the things that happens a lot is doctors, many doctors that aren't informed, give their patients a sheet of Kegel exercises. And I have a story of one woman, she was in her 90s, young 90s, and she brought the sheet in. She said, my doctor told me to do these. I don't even know where my pelvic floor is. And it was like all I could do to kind of go, okay,
Yeah.
I'm going to show you that. And, she said, I knew that I needed to go to a pelvic floor therapist. And she was so much fun to work with
Amazing.
because you
Amazing.
can strengthen a muscle at any age.
That is wonderful to hear. I it's so the same way that you clench your muscles when you're tense or you're a type A or you're stressed out, you have that same effect there, which actually is not good for you, like the rest of
Exactly.
the body.
There is research that shows people that have TMJ issues also have increased tone in their pelvic floor.
Wow. Wow.
Yeah, yeah. And that could be causing people urgency and they're not aware.
Very interesting. I'm going to come and see you. I want to learn more about this for myself. Dr. Stillman, tell us what happens to our pelvic floor as we age.
Well, aging for all our muscles leads to a decline in muscle mass and strength and function. And there's a term for that. It's called sarcopenia. Um, and it starts really around in your 50s, about 2% a year. So those people, and that can definitely be reversed.
Mhm.
But if you're a couch potato, you're going to get weaker and weaker. And those are the people that have trouble getting up from those low couches.
Yes, yeah.
So, what happens with the pelvic floor muscles is as they weaken, and if they're not being actively contracted, they're going to atrophy. Our pelvic floor is has 14 muscles in it, and five layers of muscles. And we have an anatomy model because that's a big part of education. Our society isn't really comfortable talking about our pelvic floors, our bowel, bladder, and sex
Yeah.
function. So we bring it to the forefront in a private room. We even have a mirror if, sometimes that's helpful for people.
What what's the relationship, and I'm sure there is one, between urinary incontinence and the bowels and the muscles? That it is it a comprehensive problem with pelvic floor for both sexual function, urinary tract, and bowel movement?
Well, they're all really I mean, people that come to us, but a lot of times, though, people have bowel and bladder at the same time. So, what we do in the initial consult is find out what people are having problems with, and we will give them like a bowel and bladder diary. So, let's separate that out from sexual
Yes,
dysfunction.
absolutely. Okay.
Because
Mhm.
that's a whole different
Yeah.
scenario and an important one.
Yes,
I'll get
absolutely.
I'll get
So
to
important.
that.
Yeah. Mhm.
But when people come to us, then we assess their musculoskeletal system. We really look at because because the hip muscles are some of them are attached to the pelvic floor, and we assess if there's increased tone, if there's atrophy. Another thing that I forgot to mention is for women with menopause, the decrease in estrogen causes more atrophy of the muscles. And a lot of women don't realize that there are some, local creams that they can, talk to their doctors about that can really make such a difference in that area.
Do you recommend the suppositories as well, the estradiol suppositories? And
Personally,
yeah.
I recommend the cream
Oh, okay.
because, and I have tried both, so
Yeah.
I
Okay.
could say strongly because I only did the suppositories because my doctor said they were cheaper. So I was like, okay,
Oh, okay.
but yeah, but they don't lubricate as well all the way up the
Oh,
canal.
okay. Okay.
But that doesn't mean that that's the same thing for everyone. But
Right.
for me,
Absolutely.
yeah,
Absolutely. Interesting.
yeah.
Uh, so yeah, this is so let's talk a little bit also what can be done for men.
Okay, so men have the same issues of bowel and bladder, but also the pelvic floor supports the prostate. So a lot of men and men find us on the internet. They don't wait
Mhm.
for their doctor
Yeah.
to
Yeah.
send them because they don't even talk to their
Yeah.
doctor
They're
about it.
straight to the source, right?
Right. And they want to be there by the time they get to us and they're really clear. And so prostate, the prostate gets larger. And so a lot of times that pressure on the bladder is going to cause urgency. And that's very stressful, as we all know. And they don't want to be peeing in their pants. So then again, we would do an assessment and figure out if there's tightness. We teach, them relaxation techniques, incorporate breathing techniques, because most people don't realize that when you do a deep belly breath, otherwise known as diaphragmatic breathing, your pelvic floor relaxes and descends. So there's a lot of simple strategies that you can use.
Do you see a
Um,
lot of men post prostate cancer?
we do,
Yeah.
yes.
Yeah.
And I really encourage people to come because There's frequently side effects of erectile dysfunction and urinary incontinence. And we have some amazing tools to help with that. I love gadgets, so we have ultrasound piece of equipment so we can see, they can see when they do a contraction if the bladder's moving. We have biofeedback that we use. So it makes it much more interesting, and the brain gets more connected because you have to retrain the brain. We don't realize that our bladder and bowel is like our second brain. And
Yeah.
if it hasn't been used for a long time, you have to reconnect through your central nervous system. So that's why I found all these different tools are really helpful.
Carol, I'm so encouraged to hear that you're doing this at older ages.
I
Really,
can tell
you
you,
know,
yeah,
it's you know my mantra. We've talked a little
right.
bit before we did
Mhm.
the show. That's my book, Thoughtful Acceptance of Your Age. What can we do at the age we're at? There isn't this definitive by 50 you can't do this, by 60 you're toast, by 70 it's too late. I'm so encouraged by what you're saying that you're having people at all ages come in and they're seeking
Yeah.
this out. I really I'm going to ask you a like one of the technicalities. How much of this is covered by insurance?
Well, that's a very good question. So actually, Medicare. So in our practice, we accept Medicare,
I-
and so it's insurance covers all of it if you have an insurance policy that covers physical therapy.
Okay. So it all will all fall under that umbrella. This the extra special things that you add on will also fall. That is very encouraging, also, because I think some people are frightened by what the cost is, and or feel like they can't afford that it's a luxury to go
Right.
get physical therapy, especially this type of therapy as well. And is there anything else that you can add that I really want to talk about sexual health for a minute? Is that you know as well as I do because of our age that we were it was drummed into us that postmenopause was the end. And even if it wasn't told to you, that's what society had taught us. Postmenopausally, you're done. You're no longer a sexual being, and nothing
Right.
further from the truth, right? I mean, that's so helping men and women. I know there isn't really one nutshell to say, but what could you tell us to encourage women that they can have beautiful, happy, healthy sex lives at any age?
Well, I think the best inspiration is to give an example. So
Okay.
I had a patient this year who was 82. Her husband had died a few years earlier, and she came to me because she had a boyfriend
Yeah.
and she was having urinary leakage during sex. So, and she was very funny.
Yeah.
And her daughter had found said you got to try pelvic floor therapy because her doctor did not suggest it. And so when we did an internal exam, her muscle tone, she didn't have any ability to contract at all. And actually, we ended up using internal electric stim to help her.
Okay.
But she believed because in the times when our mothers had babies, they just assumed they were going to leak when they laughed, when they sneezed.
Yes.
My
Yeah.
mother always, I thought that was normal.
Yeah. Yeah.
And that's the problem is so many people have normalized that you're going to leak when you get older, and that's that. And you're going to have to wear, it depends. And it's just couldn't be further from the truth. And that you can have a very active sexual life, and you don't have to have super strong muscles in
Yeah.
your pelvic floor to enjoy sex and have an active but you don't want to be leaking. So it's just something to be aware of. And also, if you have problems with um, dryness or things like that, we work with gynecologists and urogynecologists, and we work as a team. That's one thing about pelvic health physical therapy. We don't work isolated. We work with sex therapists. We work with nutritionists. We work with acupuncturists. And it takes a team
Mm.
because every person's unique that comes to us. And by the way, pelvic health physical therapy, all sessions are an hour because it takes time
Yeah.
to really get to know someone and be in an environment where they can really relax and learn.
So, do you recommend vibrators? I know that that's been a hot topic lately of aging, where women who can no longer climax or find it difficult to have an orgasm, that using vibrators with or without a partner help stimulate the area. And I've been reading it about it bringing back or not curing the dryness, but certainly helping with lubrication.
Well, I think that that certainly is a simple tool to try. And, it's really fun, in
Yeah.
fact, to go into those nice sex stores and you
Yes.
can, have fun and,
Yes.
and take your partner or go by yourself. You don't need a partner
Yeah.
and try things because it's all about what feels good to your body.
And that is the again the I hadn't expected to delve into this so much, but I'm curious about it. So we I want everybody out there to go study the anatomy of your pelvis, both men and women, how it works, how it affects you, how this is just such a, it will open the door to a whole new happiness for you, and that there's a remedy and there's an answer for it. So I appreciate that. And like I said, Carol, this is just getting past that embarrassment, of getting people to understand this is natural. This is where everything about our bodies is natural. This is the way we were built. This is what we were given, and
Mhm.
maximizing our pleasure, our intellectual pleasure, our physical pleasure, all of it. And also knowing you don't have to live in pain or embarrassment. Or like you said earlier, the fear that you're going to pee in your pants, both men and women, and that afraid. I know people that are afraid to go places because of it, right? It
Exactly.
inhibits your
Yes.
life in ways that it's so unfortunate that people can't sit through a movie or a
Mhm.
play or a performance, or they don't want to go to a wedding, or somewhere where they're going to have to be out for several hours in case there's not. It also inhibits your travel, right? I mean, it has a lot of negative
Absolutely.
effects on it. And I think the diaper companies are capitalizing on that. But I guess there's a happy medium with that as well. I mean, it's um, do you find women or men are more embarrassed about this, or is it even Stephen?
That- You know, because the people that come to us are, they've
They're
already
ready to, yeah,
done
they're
the
ready to make a
hurdle.
change.
So,
Mhm.
although once they're behind the doors, like some people won't let us do an internal
Okay.
exam. So I would have to say some older women who aren't comfortable with their pelvic floor will be more reserved about it, whereas young women will just jump on the table. I think the younger generation is used to being waxed, and
Yes, yes,
it's like it's just much more comfortable.
yeah.
Um, and then as far as men, I think if men have a sexual problem, they don't care what you see. They want you to fix them. So they are
Yeah,
so
yeah,
motivated.
yeah. That's very funny. That's cute. It's good to know. Good to know. So, and so I just want to move on in the interest of time. It's so I could talk to you all day about this. One of your passions in life, which we talked about, is keeping people upright, right?
Mhm.
Keeping people walking, standing, exercising, engaging in life. And so let's delve into what it means to keep our balance as we age and why it's so critical.
Well, fall prevention is so important. And I really learned that. I've had my practice 26 years, and I would see like someone came in, from the community for back pain. And then 3 years later, they walk in, they fell crossing the street, they have a wrist fracture. Someone else came in, she lived alone, she was changing a light bulb. We all know not to do that. She fell off the chair, fractured her hip. And and my mother fell all the time.
Oh,
I started to say, what can we do about it? And then I just did a lot of reading and a lot of research, and I decided we are screening all our patients, no matter what they come in for. They come in for shoulder tendonitis, we're checking their
Yeah.
balance.
Yeah.
So we do that with everyone. And because falling is the second leading cause of accidental or unintentional injuries, with hip fracture being one of the leading causes. And oftentimes people don't come back from a hip fracture. They end up dying in the hospital because hip fractures can be very complex. You can end up needing surgery, and it can be the beginning of the end for many people. So I say we are going to prevent it. How do we do that? First of all, we assess what someone's balance is, you
I want
know.
to ask you,
Oh,
I want to hear all this deal, but I want to ask you something. We keep hearing this.
okay.
When you say someone falls and fractures a hip, and I've heard it can be fatal. Um, Details. So is it the pelvis that's fracturing, the hip, the actual leg bone? What is the, tell me about the mechanics of that. So you fracture a hip, you're fracturing the pelvis, you fr why does that lead to death? Because I had a hip replacement. It wasn't fractured, it was arthritis. How does that lead to death? Tell me why you can't come back from that.
Well, it depends how, what other comorbidities you may have at
Okay.
the time.
Okay.
So if someone, very in shape and active fractures their hip, but let me answer your first question. The pelvis is, like if you put your hands on your hips, that's your pelvis. You can fall and fracture your pelvis.
Okay.
Um, so it's like the ring around our organs, or you can fall and fracture your femur, which is
Okay.
the bone, and the different parts of your femur. And then
Okay.
fractures can be what they call a simple hairline fracture, or you can have what's called comminuted, where it's extensive fractures and you're going to need surgery. So if you have someone like I'm thinking of one of my friend's dads right now that even though he had 24/7 aid, she wasn't watching carefully. And he fell at home when he was already very ill at 92. And those are the ones that, can end up dying. Like my stepfather had Parkinson's and fell and fractured his ankle. And that was the beginning of his decline because it just made him more immobile.
Right. So there's the compound of maybe getting pneumonia or the
Right.
inactivity or laying in
Mhm.
bed or not eating, all those things that come with
Right.
post-surgical or post-injury.
And
Okay.
having to be hospitalized.
Yes.
Exactly.
Yeah. Oh, that's a whole, yeah. Yeah. I'm hoping we can have a Star Trek type thing where there's some laser that you beam on the hip and it heals for you. Hopefully we'll reach that. So let's talk about balance and talk about what you do to get people A, evaluated for their balance, and B, how to bring that balance back, if you will.
I tell everyone you can strengthen balance just like you can strengthen a muscle. Because people just think, oh, I have bad balance or oh, I have bad posture. But balance is something that you absolutely need to work on. And what I've found with our patients is you need to give them, it has to be done every day to really make a difference, to really improve it. And so, for example, do a single leg stance while you're brushing your teeth. So you're near the sink, you don't have to worry about falling. Other things they can do tandem walking, along the wall. Try that, one, so you're heel to toe walking. We do obstacle courses in the clinic. So people have challenges because when you're walking in the New York streets,
Yes.
um, I don't know, because people drive in California, but anyways, that there's lots of obstacles, including moving obstacles that come in front of you. One of the most important things we do is multitasking. So working on gazing off to the side. So many people that are fearful of falling look down. And that's one of the worst things that you can do because you need your visual input for balance for when you're walking. And so we work on, we'll put letters of the alphabet up on the sides of the wall. So, read me that letter, read me that letter. So they're having to do head turns
While
while
they're
they're
walking.
walking.
They're
Right,
walking and reading the sign.
right.
That's very interesting because I always thought that that was detrimental because your multitasking causes confusion. You should be paying attention
Mhm.
to your walking. So tell me about proprioception. That's exactly what you're talking about there.
Well, proprioception is where your ability for your joints to know where they are in space.
Mhm.
So we work on that. So that's part of when you're standing, and then we challenge the proprioception by those things like, visual. Because frankly, when you're outside, you're going to have to turn to look, especially now. Well, I always talk about New York, but you got to look both ways for those bikers coming through.
Yes, yeah.
So
Wherever you,
there's
I think, this is a national audience. Wherever you are, you need to pay attention.
right.
Whether you're walking on a country road, the middle of a city, along the beach, whatever it might be, you need to pay attention to your surroundings. Absolutely. It's funny you say that about looking down. Does looking down cause you to fall forward?
No, it doesn't cause you to fall forward, but it doesn't help your
Oh,
balance.
okay. That's
But
very,
it's kind of like when people are learning to dance,
yeah.
they look at their feet, and you need to experience things through your whole body. And if you're looking down, you're not really able to take everything in.
Do you find in your experience with athletes that come in or people who've had injuries? I've always found this fascinating. My whole life, I've done symmetrical sports. Dance classes, when I weight train, I do exactly on the left that I'm doing on the right. And I
Mhm.
ran many, many marathons, which to me is a very symmetrical sport. Um, I'm ambidextrous, so I had trouble with racket sports. Do you find people who played tennis or golf or baseball or anything of that sort that they had to favor one side of their body, have more difficulty with balance or less? Was there any correlation with that?
I haven't found that as far as balance. Usually people are pretty symmetrical unless they have had an injury,
Okay.
on that lower extremity.
Okay.
But it's interesting because a lot of times we'll work with them and they end up getting better on the injured
Okay.
side.
Oh, interesting. That's very
Yeah.
interesting. And do you find that when somebody has an injury and they come to you, whether it's a hip, an ankle, a foot, a toe, whatever it might be, do they come in and do you find other imbalances or abnormalities while you're at it? Because it's interesting that someone can hurt themselves on the left side, but actually the right was the weaker leg.
Absolutely.
Yeah.
And to me, that's the sign of a good physical therapist, is to really figure out what's causing the problem. Because the person can be having a problem in their right hip, but it really can be due to something going on in their left pelvis
Mhm.
that's asymmetric. So you really have to, that's one thing that physical therapists are expert in, is analyzing motion.
And how compliant are your patients? I wanted to ask you about the overall approach you take when treating an
Right.
older adult. That, you know, first of all, walk us through an assessment of an older adult. I'd be curious. And I say older adult because I'd imagine someone older, I'm not saying this with everybody, may come in not having worked out in a long time or don't have a sense of their structure or their balance. So when you go through that with them, how compliant are they? I guess it's
Well,
someone's very motivated, they would be. But
right. Well, I always say to the physical therapists that work for me, part of our job is to help people become more compliant.
mhm,
And so a lot of times people aren't in the beginning,
right.
but then if they are really inspired and they have a goal of something they want to do, it's up to us to really educate them why they're not going to get better if they don't do these things at home. So sometimes people have to fail in the beginning in order, like so many people I can think of that won't use their cane, even though they need to, and then they fall, and then they come in and they'll use their cane. So to me, compliancy, it's complicated because it's a dance between not just physical therapists, but any provider you're going to, right? And the person, and being able to accept where they're at and then help them through education and giving, trying structure to become more compliant. As far as one of the things I found with older adults, besides we assess everything as we do with all teens and adults, is gait speed. And
Mhm.
they say that gait speed is like the sixth vital sign. And when you see people walking slower, that's something that means they have some balance issues going on, they have some weakness going on. And we do a 10-meter walk test, and there's norms based on age of what someone's gait speed. And there's a certain gait speed that you need to cross the street. It needs to be 1.2 meters per second. And the lights are not, well, like, the only place I've seen long green lights is Washington, D.C., for walking.
Yeah.
I don't know why, but they really give people time.
Okay. Mhm.
But here, if you walk slowly, you see those people in the
Oh,
middle of
sure. They're halfway through and the lights changed.
I
Yeah. Yeah.
know. So that's something that I focus on with our older adults.
And that is very interesting to me because how do we come to terms with that? One of the things I like to say as we get older, you slow down because it's good for you to slow down, meaning it's good for you to
Mhm.
calm down, eat slower.
Right,
And instead of reacting with a volatile response, think about what you're going to say before you answer. And these are something that older and certainly more highly evolved people do. They think before they act rather than acting impulsively. So when somebody's doing that, is it an actual they're walking slow because they can't step it up, or it's fear, um, all of the above. I understand shuffling or walking slowly, you can actually fall faster than if
right.
your stride is wider. Uh,
Mhm.
yeah.
I think there's a diverse set of reasons why someone might be walking slow, and that's what we have to figure out.
Now, when you are working with runners, let's say, or people who are, as they're aging, they're running slower. They're going
Mhm.
from the
Right.
7-minute mile to the 9-minute mile to possibly even the 10 or 12-minute mile. And do you encourage running fast at all ages? Tell me about that. I'm curious.
Oh, that's different, and I think that your running speed should be, because if you're running to stay healthy, it should be what you enjoy.
Okay. Yeah.
Uh,
Yeah.
so to me, walking speed is like is basic.
Okay. Okay. And the idea of when somebody has an injury post, I hate to say it, but hip replacements are the new going out for coffee. It's like everybody has it and everybody's talking about it wherever we go. Thank God they're available. It's been a wonderful thing for most people. But a lot of people think they don't need the therapy. Oh, I don't need the walker, or I'm up and around, or I feel okay. Um, this is what we need to encourage people to follow the plan.
Well, and what I find is people don't have a total hip replacement, right, something sudden. They have been having deterioration due to it's typically osteoarthritis. So those muscles have been slowly getting weak for a long time in the core.
Mhm.
So if they have a total hip replacement, and you're right, we don't get many referrals because the orthopedic surgeons don't send them to us, but we get the total knees and the total
Yeah,
shoulders.
yeah,
But if anyone ever asks me, I'm like, you need to come in and let's assess what your strength is versus what it could be and your balance.
yeah.
Because most people have lost their balance and they have a whole new joint in, but you have to work on the proprioception. So it's really important. And I also would have put a plug in for aquatic physical therapy because I know that,
Tell us about the aquatic. I know it's something you do and it's amazing. It's being in the water. Tell us how that's beneficial.
well, it's been the most amazing new program I've added. We have the only full-size aquatic therapy program in Manhattan because in Manhattan, there's just not a lot of pools.
Right.
And we have so many people after a total knee or a total hip where and their wound has healed, it's so much easier due to the buoyancy of the water to start walking and working on their gait speed and on their step length and on their balance. And balance is one of the best things to work on in the pool because you take away the fear of falling.
Hmm.
What's interesting is the fear of falling is a risk for falling
Right.
because you think about people that are scared to walk, and so they're on edge and they are not going to be able to react if they accidentally trip. And so in the pool, we, have a lot of fun with people, and also the water that is the hydrostatic pressure of the water. I tell people it's like a giant Spanx. So
Yeah.
it kind of
Yeah.
keeps you
Yeah.
upright
Okay.
to work on balance. But we work with a lot of post-operative patients in the pool, and it allows them to start movement sooner. That's pain-free, so that they can get better quicker.
That's amazing. And do you have is it a waist height or neck height pool that you uh is the person almost fully submersed in doing this or it's
We it starts out at 3 feet.
okay?
And there's a lift for people that need that way to get into the pool. And then the deep end is 6 feet where, but we work with people, it's either vertical or horizontal exercise. A lot of times, we put flotation devices underneath people and we can work on lumbar distraction or, different things, shoulder mobility, where they are not able to raise their shoulder, on land. So, but yeah, it's not swimming at all. You do not need to know how to swim.
And post surgery for knees, hips, and shoulders, can you achieve full mobility after?
Well, that depends on what type of surgery you had. I mean, our goal is to always restore, as best as we can. But it depends what the person had before, what their diagnosis is. But we end up getting a lot of failed knee replacements because they didn't get the movement. And so in the water, we can do a lot better.
Yeah, and so they can get back to some decent level of
Functional.
mobility, of
Right.
functionality, right?
Yeah.
Okay, that's the key. Dr. Carol Stillman, I want to thank you. This has been so informative. There's still so much to talk about, as usual, but I wish you the best with your practice and your outlook, and thank you for being here. I mean, it's been amazing, and I'm sure your patients love and appreciate all that you do. And for more information about Sutton Place PT, you can go to www.suttonplacept.com, located in Manhattan, New York. But this is good for everybody to hear. Carol, I want to hear, tell me what you like about getting older.
My life has gotten better every year. And I was a late bloomer. So, I mean, I bought my business when I was 43. I had my children in my 40s. I found my voice in my 40s. And I now know what brings me joy. And I have the confidence to not settle for less than that. And the other thing, I've learned how to ask for what I need and delegate a lot and listen to myself. And so for me, aging has brought me because I've learned a lot of lessons by making mistakes. So the beauty of aging to me is you get to get a lot of things right.
Yes, absolutely. There's so much more to life as you get older. There's no question about it. Thank you again so much. And I want to thank all of you for listening to It's Okay to Be Old. Please tune in again for our engaging discussions on all things aging well. And for feedback and topic requests, please contact me at www.patriciagreenberg.com. Thank you again, Carol, and I wish you the
Thanks.
best.
Thank you, Patricia.